Hello Pharma guys, welcome to our channel Easy Learn Pharma. Today I am going to discuss about the another important chapter of the pharmaceutical subject. So what is that name? That name is pharmaceutical suspension. So my dear students, from this chapter maximum questions will be arise in your competitive exam paper. Okay, so listen carefully what I am telling regarding the pharmaceutical suspension. So before going to the pharmaceutical suspension chapter, first of all you should know what do you mean by suspension. What do you mean by suspension? So that you can easily understand what I am telling regarding the pharmaceutical suspension. Clear? So suspension. Suspension means what? A suspension means the condition being suspended. Okay. So what do you mean by suspension? The condition being suspended. Okay. So you mean the condition being suspended? So I'm giving the another example so that you can easily understand what do you mean the condition being suspended. Okay. When the drug are not dissolved, when the drug are not dissolved but suspended in the liquid medium, this condition or phase is called known as suspension. Okay. When the drug are not dissolved but suspended in the liquid medium. This one is the liquid medium. Okay, in this liquid medium, the solid particles or the drug particles are uniformly suspended. In that time, you can say this condition or phase is called known as suspension. Clear? So I'm giving the another example so that you can easily understand what I'm telling regarding the pharmaceutical suspension. Clear? So suppose there is two beakers. Okay, there is two beakers. One is A beaker, another one is B beaker. Okay, in A beaker you have to take the sucrose 5 gram with water 10 ml or 20 ml. Okay, so in the A beaker you have to take 20 ml of water and 5 gram of sucrose. In the B beaker you have to take sand, 5 gram of sand and 20 ml of water. Okay, so in the A beaker you have to take the 20 ml of water and 5 gram of sucrose. In the B beaker you have to take the 20 ml of water and 5 gram of sand. Okay, so you have to stir thoroughly both the beakers. Okay, you have to stir thoroughly both the beakers. After some time definitely will be marked in the A beaker all the sucrose particles are completely dissolved in the liquid medium and form a solution. Okay, but in the B beaker what will happen? But in the B beaker you will be marked all the sand particles are uniformly distributed or are uniformly dispersed in the liquid medium but not dissolved. Okay, and form a heterogeneous hetero heterogeneous system. It is also called as suspension. Okay, so this one is the solution and this one is the suspension. When the drug are not dissolved but dispersed in the liquid medium, this condition or phase is called known as suspension. Okay, the medical example or the medicine, the another example is paracetamol oral suspension. Paracetamol oral suspension IP 250 mg. So my dear students, the paracetamol oral suspension IP 250 mg you have to administer to the pediatric patient, Why? Now because the pediatric patient do not swallow the tablet. Okay, in that time you have to administer the paracetamol oral suspension IP 250 mg. Clear? So that is the example of pharmaceutical suspension. So now come to the point. What is the actual definition of the pharmaceutical suspension? Okay, so what is the actual definition of the pharmaceutical suspension? The pharmaceutical suspension are biphasic liquid dosage form or biphasic liquid dosage form. Okay, in which in which the finely divided solid particles are uniformly dispersed in the dispersion medium by using the suspending agent. So that is called known as pharmaceutical suspension. So again I am repeating that part. What is the actual definition of the pharmaceutical suspension? The pharmaceutical suspension are the biphasic liquid dosage form. Are the biphasic liquid dosage form. Why? Now because one is dispersed phase, another one is the continuous phase. So that's why the pharmaceutical suspension is a biphasic liquid dosage form in which the solid particles are uniformly dispersed in the dispersion medium by using the suspending agent. That is called known as pharmaceutical suspension. Clear? So now come to the point. The another definition of pharmaceutical suspension. Okay, what is the another definition of the pharmaceutical suspension? The pharmaceutical suspension is also a heterogeneous system. Okay, it is a heterogeneous system. Maximum some question will be arise. Pharmaceutical suspension is a which system? And it is a heterogeneous system. Okay, consists of consists of two phases. One is internal phase, another one is external phase. Okay, just I am discussed regarding the pharmaceutical suspension. One is dispersed phase, another one is the continuous phase. But now I am discussed regarding the pharmaceutical suspension is a heterogeneous system. Okay, it consists of two phases. One is internal phase, another one is the external phase. So what do you mean by internal phase or what do you mean by external phase? Okay, pharmaceutical suspension is a heterogeneous system consists of two phases in which the phase are uniformly dispersed throughout the external phase. So that is called known as pharmaceutical suspension. Okay, that what do you mean by internal phase? And that is the particulate matter, the particulate matter or substance is called known as internal phase. Or what do you mean by external phase? Now in which medium the particulate matter will be dispersed. This medium is called known as external phase. Okay, that is liquid medium. Clear? So what do you mean by internal phase? And the particulate matter are dispersed. That is the internal phase. And in which medium the particulate matter are dispersed? This medium is called known as external phase. Okay, in the diagram, these are the solid particles or these are the particulate matters are uniformly dispersed in the liquid medium. So the particulate matter is the internal phase and the medium is the external phase. Clear? So now the actual particle size of a good suspension. So what is the particle size of a good suspension? The particle size of a good suspension, that is 0.5 micrometer to 5 micrometer. Okay, so 0.5 micrometer to 5 micrometer, that is the actual particle size of a good suspension. Clear? So now come to the point, types of suspension according to particle size. Okay, so now I am going to discuss about the types of suspension according to the particle size. According to the particle size, the suspension are of two types. One is colloidal suspension, and another one is porous suspension. Okay, so what do you mean by colloidal suspension? And what do you mean by colloidal suspension? Clear? So what do you mean by colloidal suspension? Now in which suspension the particle size less than 1 micrometer. Okay, those particle size of a suspension having less than 1 micrometer, that is called known as colloidal suspension. And those particle size of a suspension having greater than greater than 1 micrometer, that is called known as colloidal suspension. Clear? So first of all, pharmaceutical suspension according to the particle size, it is of two types. One is colloidal suspension, another one is the colloidal suspension. Clear? The colloidal suspension particle size less than 1 micrometer and the colloidal suspension particle size greater than 1 micrometer. And what is the particle size of a good suspension? 0.5 micrometer to 5 micrometer. Clear? So now I am going to discuss about advantages and disadvantages of a pharmaceutical suspension. Advantages of pharmaceutical suspension. Okay. So my dear students, there are so many advantages of pharmaceutical suspension are there. That's why you have to prepare the pharmaceutical suspension. Clear? Simply you can say some of the drug particles are there. That drug particles are not stable in the solution form, and such type of drug particles you have to prepare in the suspension. Okay. So first one is the stability part. First one is the stability part. That means some of the drug particles are not stable in the solution form. So in that time you have to take the drug particles in the form of an suspension. Clear? So as for example is procaine, penicillin G. Okay, that procaine penicillin G is not stable in the solution form. So that procaine penicillin G you have to prepare the suspension to enhance the stability of the procaine penicillin G. Clear? And the next parameter is so the first sentence of the advantage of the pharmaceutical suspension to enhance the stability of a certain pharmaceutical drugs. That example is procaine penicillin G. Clear? And the second point is masking the bitter taste, masking the unpleasant or bitter taste. Okay. Obviously, all of you know that all the pharmaceutical drugs when you have to take in the raw form, definitely the taste having the bitter or unpleasant taste. And when you have to prepare the suspension by using the drug particles, in that time you can easily masking the bitter or unpleasant taste by using some flavoring or by using some sweetening agent in the preparation of suspension. So that in the suspension you can easily masking the bitter and unpleasant taste of the drugs. Clear? And the next parameter is prolonged release of drug or controlled the release of drug. So my dear students, the most advantages of the pharmaceutical suspension, now you have to control the drug release or you have to control the drug release. How? Now in that time you have to enhance the viscosity of the medium, and when you have to enhance the viscosity of the medium, in that time medium act as a reservoir. Okay, in that time the medium act as a reservoir. And what do you mean by reservoir system? Now in that time in the reservoir system some pores will be present, and from the pores the drug will be released. Okay, the drug will be released. So when you have to enhance the viscosity of the medium, in that time the medium act as a reservoir system, and after that the drug will be released for a longer period of time. Okay, so by enhancing the viscosity of the medium, we have to control the drug release kinetics. in the preparation of pharmaceutical suspension. Clear? And the next parameter is bioavailability. Bioavailability. Okay. So what do you mean by bioavailability? Bioavailability means what? Now bioavailability means the rate and extent of a drug. Okay, the rate and extent of a drug observed into the system in circulation, that is called known as bioavailability. So what do you mean by rate and what do you mean by extent? Now the rate and extent, that means in which rate, okay, in which rate how much amount of drug enters into the system in circulation, and that amount of drug shown the therapeutic action, and that is the bioavailability of that drug. Clear? So in the pharmaceutical suspension, the bioavailability is more than the other dosage form. So the ratio is solution greater than suspension greater than capsule greater than compressed tablet greater than coated tablet. So my dear students, in the solution, the more bioavailability will be occurs. Okay, and in the suspension, okay, so first the solution is the more bioavailability, then the suspension, more bioavailability than the capsule, then the capsule more bioavailability than the compressed tablet, then the compressed tablet is more bioavailability than the coated tablet. Okay, so first solution, then suspension, then capsule, then compressed tablet, and next one is the last one is the coated tablet. Clear? So these are the advantages of the pharmaceutical suspension. Clear? So first one is the regarding the stability. Okay, the pharmaceutical suspension enhance the stability of the certain drugs. Example is procaine penicillin G. And next one is the masking the bitter and unpleasant taste of the drug. As for example, chloramphenicol palmitate. Okay, next one is the we have to control the release of drug. Okay, as for example, procaine penicillin G. Okay, then the next one is the bioavailability. Sorry, we are enhance the bioavailability of the drug by the preparation of pharmaceutical suspension. Okay, so next one is disadvantage of pharmaceutical suspension. Okay, so disadvantage of pharmaceutical suspension. So what are the disadvantages are there? So the first disadvantage is it is bulky. It is bulky, so difficult to transport. Difficult to transport. Clear? And the second disadvantage is physical stability. Physical stability when sedimentation and compaction will occur. Okay, next one is dose precision. Okay, so my dear students, so first one is it is bulky, so difficult to transport, and second one is the main disadvantage of the pharmaceutical suspension, it affect to the physical stability. So how the physical stability will be affect in the pharmaceutical suspension? Now when the sedimentation and compaction will occur during the storage condition. My dear students, suppose This one is the suspension, pharmaceutical suspension. Okay. So what is the definition of the pharmaceutical suspension? In this suspension, all finely divided solid particles are uniformly dispersed throughout the dispersion medium. Okay. And that the most important part, three, that is the most important part of the pharmaceutical suspension. Now, when we have to take the pharmaceutical suspension, in that time we have to shake well before use. So why you have to shake well before use? Now because after some time, okay, during the storage, after some time, all the solid particles are sedimented on the surface. Okay, are sedimented on the surface. And when you have to shake properly, in that time, all the sedimented particles again redisperse throughout the medium. And in that time, when you have to take the dose, in that time you have to take the accurate amount of dose. Clear? So how the affect the physical stability in the pharmaceutical suspension? In that time, if after sedimentation, okay, during the storage, after sedimentation, if all the solid particles compared to each other and sedimented tightly on the surface, then definitely that sedimentation particles leads to the hard cake. It forms a hard cake. Okay, if the hard cake will be formed during the storage condition, it cannot redisperse again on gently shaking. That means if the hard cake will be formed on in that time, when you have to shaking again, in that time all the particles cannot redisperse again. So when you have to take the dose, in that time only the liquid particles, only the liquid medium, or only the liquid part will come out from the container, and you can take the accurate amount of dose. So that's why it affects the physical stability of the pharmaceutical suspension. Clear? And last one is the dose precision, obviously. And when you have to take the amount of dose, in that time, if the solid particles form a hard cake, so it cannot redisperse again, so only the liquid part you have to take. Okay, so that is the dose precision. Clear? So that is all about the pharmaceutical suspension.